Hello, everyone, and welcome to our webinar today. This is Transforming Social Care, how Blooming Health is leveraging automation and interoperability to drive impact for social care programs. Thank you for everyone who is attending today. And we will get started, and I will pass things off to our CPO, Naman.
Talk to you about how they could help your organization take your work to the next level. There are two key critical capabilities that we want to discuss today, which are automation and interoperability. These capabilities drive efficiency and connectivity in modern healthcare solutions, and there's a lot of applicable basis for the ecosystems that we're in. To start off with, uh, talk about automation, right? I think a lot of folks have heard about automation, but it's important to speak about what it means in the context of our work and with Blooming Health specifically. The initial goal is to reduce manual and repetitive work and move that to a digital system. The kind of the benefits of this are saving time so that you can kind of focus on the more important tasks, right? Uh, Additionally, some of the capabilities that we offer are allowing organizations and staff to customize what triggers and conditions kick off certain tasks or workflows. For example, it can be member intake form, it can be responses from a survey or a screener for a member that identifies a need, and then those can be inputs to say, okay, now kick off this task that I typically do manually. Additionally, it's not complete without allowing you to create a sequence of events or tasks. So Blooming Health really provides the ability to create n number of tasks or sequences in a way that accommodates your current workflows. The goal really here is not to create a new system of work for you, but to replicate what you're already doing in an automated fashion. And lastly, it's set it and forget it, right? The whole idea here is these things that you're doing today, once you set them up, you can just run them and they will run consistently without fail and get the data that you need, and that it will send it to the right places where it needs to go. With regards to interoperability, again, another term that I'm sure a lot of people in the healthcare space are familiar with, it's about what we want to focus in on is integrating into existing infrastructure for your organizations. These could be CRMs, these could be referral platforms, different case management software, so that you don't have to leave those platforms to do your work, right? We want to be able to orchestrate work across these multiple platforms. By integrating, we allow automatic and real-time push and pull of data. Um, this is to make sure that the systems are in sync. This is to make sure that the right triggers are triggering off the workflows in the right systems, and there's not a disconnect and a kind of just a sprawl of systems that you have to manage manually. When we talk about interoperability, Blooming Health offers a variety of different protocols, including REST APIs, FHIR, more of the healthcare standards, and also direct integrations. All right. So let's talk about the benefits of automation and automated workflows, right? As I mentioned earlier, the goal is to focus on people, not paperwork. We know everyone in this industry is strained, right? There's capacity challenges. There's more work and members and clients to provide services to that we can handle. So our whole philosophy is, how do we take that menial work off of your hand so that you can focus on delivering the quality care to your clients? What this also allows us to do is get a holistic client view, right? It is kind of as in tandem interoperability. By automating your workflows, we can rely on getting consistent data, such as screeners, needs surveys, and those sorts of things on a regular basis. It can help you conduct follow-ups and get all those key data points in reports, right, that are usable to you and your organization. Just moving on. All this allows you to improve outcomes uh, by being able to reach more clients through an automated way and also in a more equitable way. As many of you know, Blooming Health offers this platform across a lot of low-tech channels like SMS, voice calls, and emails in 80 languages. So with the idea is reduce the barrier to access, but then also scale that up, for hundreds of people, thousands of people, it could be tens of thousands of people, so that you don't have to do all those follow-ups manually. That is a big choke point, and designing a system that does a lot of that kind of that manual work for you can result in better outcomes for your organization. This also helps with accountability and compliance. A lot of these organizations and folks on the call today have compliance standards they have to meet, right, from your funders, from the government, uh, and accuracy and kind of completeness is important. So doing this allows you to set up the right reports, the right structure, as I mentioned earlier, to get that data in the right place and be able to deliver it in a timely fashion, which then of course affects funding and evaluations and so on and so forth. On the right over here, I want to just kind of highlight, this is our new interface or if you just stay on the slide for a second, this is kind of a snapshot of what we talk about when we say automation and workflows. It's to really reduce it down. It's a series of boxes and arrows that drag and drop and say, this is my current workflow. I want to emulate this digitally, right? And we have various triggers. We have various steps around communication engagement that then allow you to basically like virtualize all these things so you don't have to manually do these and provide flexibility. So what may work for one organization may be very different for the other organization, right? So our goal is kind of accommodate all those different use cases, trigger points, and actions, so you don't have to modify your workflows too much. And with that, we will transition over to a use case of automation where we're currently applying, and I'll kind of give it over to Rushabh to talk about that.
Thanks, Aman. Yeah, let's explore a real world case where automation can actually transform the social care delivery, right? So we're taking an example of a community care hub that has partnered with food pantries, service organizations, and healthcare providers to tackle food insecurity and other challenges within their members. Now, the general process that this organization used to follow in terms of identifying the food insecure individuals, ensuring follow-ups, and just connecting them with the right services, right, was highly manual and time consuming. Uh, Obviously, it was difficult to track the follow-ups that was leading to kind of interventions. And the process was not scalable due to the administrative overload in general. So what we did with Blooming Health is we automated the solution using Blooming Health automation. One of the best things about Blooming Health automation is your members don't need to be computer literate or they don't need to be having smartphones. We help them, we help organizations reach them on the low tech devices. For example, you can like reach out on SMS, you can do phone calls, and then you can also send some email communications, but primarily allows you to reach your population without having any internet dependencies. So what Blooming Health does is sends a food security survey on the preferred channel of the member and in their preferred language. So Blooming Health does this in 80 different languages. If a member is identified at risk of being food insecure, based on the level of risk, what Blooming Health system automatically does is either send them a phone number or a hotline number for an emergency hotline, or sends them information of a local food pantry. And at the same time, automatically sends a notification to their caregiver that the person that they're taking care of has been detected as food insecure and what are the potential next steps that they can follow. Right? So not just kind of reaching out to the member who has been detected as food insecure, but at the same time, automatically reaching out to the caregiver just by defining set of rules using Blooming Health automation. Now, at the same time, what it also does is schedules a follow-up survey to check in on the member whether they kind of started utilizing the services or not after 7 days. If this member responds to the survey and says that they have started utilizing the resources, then they just kind of, the organization monitors this individual, whether they are tracking in the right direction or not, and whether the steps that are taken is helping them or not. If they haven't started utilizing it, if they mention that on the survey, a counseling is scheduled for them. And if they don't reply within 24 hours of a survey being sent to them, a staff member is notified that there needs to be a manual intervention in here. So now, with this kind of automation, what it allows this organization to do is the staff does not need to do each and everything, right? From identifying the food need to reaching out to relevant people right at the beginning and for each and every member. Automation takes care of a lot of these things and actually offers a timely personalized support by doing this. It's a scalable model, right? Can be done for multiple individuals at the same time. And it's not just limited to food needs, right? If you can move on to the next slide. Uh, it's scalable to housing, transportation, and other healthcare needs as well. The solutions would be different and custom for each and every organization, but the Blooming Health automation system allows you to kind of personalize it the way you want and the way your processes are set up. It not only does that, but with this kind of an automation, the organization saw improved community outcomes and real-time tracking in terms of all of the follow-ups that they were doing. And it really helped them kind of reduce the administrative overload at the same time, improving the member experience. Now, this is how kind of automation empowers an organization to act faster, smarter, and at scale. So this was just the automation piece, but there is also an important piece around interoperability. What are the benefits of interoperability? I'll pass it on to Naman to share some light on that.
Great, thank you, Rishabh. And I think that's a very critical point, right? Automation truly works better when interoperability comes into play because we all systems in the equation, right? It's not just one or two. And I think replacing all of them with one is also never an easy discussion to have. And so this is how we kind of think about our strategy, about the ecosystem, how we want to play with other systems. And our goal really is to make it simple, right, for everyone to kind of connect to different systems. So the benefits, a lot of these are self-explanatory, but I think it's important to discuss them. Creating seamless integration with your existing IT systems that are being used for various purposes. They could be CRMs, they could be system of record, could be case management software. Our goal on Blooming Health is to provide various connectors, various type of integration points that make the process to kind of deploy something easy, right? We offer Salesforce connectors. We offer an HL7 Fire interface. We have a set of APIs. We can also accommodate flat files or SOAP formats. The idea here is that whatever systems you're using, with them, right? And be able to create that connectivity that can empower a lot of those automation workflows. Moving on to the next point. Right, so with interoperability and integration comes real-time data exchange. So we have kind of set up our infrastructure to be able to push and pull information from your systems and between Blooming Health, keep your member data up to date, right? We want to make sure when you are conducting your operations and doing your tasks, you have the latest data because that is critical. It's not sufficient to get a response from a needs screener a week later. When you detect a need for a member, that has to be known immediately so you can kind of take the appropriate action. So our goal is to provide those interfaces so you are getting that data. The benefit of interoperability is also eliminating double documentation. Systems that are not connected do require input into multiple systems, right, to keep things in sync. It could also mean transferring data like manually through like CSV files and all, if data changes for let's say members' phone number or members' kind of needs. Our goal is to kind of remove that process, which also minimizes errors. Going to the next one. This also leads to scalability and flexibility by having access to an integration or orchestration layer in your organization. You can now connect other systems to it, right, to the ecosystem that we can funnel data back and forth through. And the idea is you can have systems that serve a specific need and now can all kind of work together in a more seamless way. Let me one last point here, Marina. And as we alluded to earlier, this helps kind of create that holistic view and centralized record keeping. We don't want to manage different data sets from different systems and try to reconcile that later on, right? As part of a manual effort. Especially in 2025, the SaaS world, they're already doing these sort of things, and we're trying to help the social care, healthcare world really move to the current kind of times we're in, and the technology is there, and we're trying to provide the solution to do all that. On the right, we just have, as I mentioned, just a diagram about the options we offer. We also do some custom integrations if you have a proprietary system. The goal is reduce the burden to make those connection points so that we can kind of get the data flowing and help you accomplish the tasks that you're currently doing manually today. With that, we'll turn over to Rishabh for another use case example on that focuses around interoperability.
Thanks, Salman. Yeah, so now let's take a look at how automation and interoperability together kind of work in terms of driving efficiency. So this is from a faith-based community-based organization who actually runs our Meals on Wheels program. And so primarily their activities, they do like coordinate the meal deliveries, whether the person needs a meal delivery or not, track their responses, when do they need the meal deliveries, and then also kind of ensure whether the meals were delivered, were they satisfactory in nature or not. But the primary challenge in here is the primary system that they have been using is Salesforce. And it's really challenging for staff members to kind of go through multiple tools at their end, right? So if Salesforce is their primary system, and then now they have to use other tools as well along with it, just for certain activities, it increases the burden on the staff. At the same time, all of your data is now residing in multiple systems. There's no single point at which you have all of your centralized data. So with Blooming Health, interoperability or integration and automation, what we did for this organization, Arina, if we can move on to the next slide. Yeah, thank you. So we integrated with their Salesforce CRM and with a set of rules that we created for automation within Blooming Health. Whenever a member was created or updated on their Salesforce system at a set frequency during the day, what we do is automatically create this member's profile within Blooming Health or update if any details were changed for this particular member. Now, what this also allows them to do is create a segment of an audience within Salesforce that they could add a particular field and call it a particular user segment, which is then utilized by Blooming Health, that whenever a particular user gets added to this audience segment, we automatically send them a survey to check if they require a meal whenever the next delivery is scheduled. As soon as this member responds, the survey's results are sent back to the Salesforce system using the Salesforce integration. And now on their Salesforce system itself, what they can easily monitor which member is looking for the meal. Now, based on who is looking for the meal, they send a broadcast whenever the delivery is scheduled. And whether this message got delivered, not delivered, do they need to resend a message in case someone was not reachable? the status of it automatically is synced back onto Salesforce. And then once the meal delivery is completed, they can again like send a survey to check whether the meal was delivered or not. And if they were satisfied with the meal, again, all of the data syncing back to Salesforce. So here, at each and every step of automation, the data is moving back to your parent system or the primary system that you are using. In this case, it is Salesforce. But at the same time, you don't really need to log in every time you want to do something on Blooming Health. With automation, your repetitive actions or steps which you usually take in your process are automated, and the information comes back to your primary system, making your life a lot more easier. So with this, uh, you know, effectively what we ended up doing, yeah, Marina, if you can move on to the next slide. Uh, the overall impact was the automation saved a lot of time, because otherwise using two systems and ensuring the data is consistent between the two systems would have taken up a lot of time. It ensures that every meal delivery and recipient is actually accounted for. It seamlessly integrates between the two systems, and reduces your administrative burden overall. And obviously, it improves the engagement with real-time response tracking as well. So this, kind of uh, combination of automation and interoperability, it highlights how technology can actually enhance social care operations and allow organizations to focus on people, which was our goal with automation and interoperability, and not focus on processes. Over to you, Marina. Sorry, Marina,
You're on mute, Marina.
Thanks, gang. I just want to say thank you so much to Naman and Rishab for walking us through all of that today. And I'm just going to go over, the few key things that we covered today and wrap us up. Automation is here to save your team time and increase your efficiency. We're eliminating manual work so that you can spend more time on the individual human interactions and reaching people on that human level by covering the things at scale. We integrate with sales platforms like Salesforce to create seamless workflows, reducing the burden to your team, ensuring accurate data. And all of this leads to higher participation rates, better engagement, and more time for your staff to focus on what really matters. All right, we have 5 minutes, so I can take a question here. And for anyone who's interested in learning more, I have included a link in the chat. And you can also go ahead and scan the QR code that's on the screen. So let me throw this one to you, Naman. Someone asks, what security measures are in place to stay compliant?
Yeah, that's a great question. Because we work in the space that we're in, a lot of our customers have compliance requirements. So we are HIPAA compliant, and we're working towards, we're on the path to NIST and high trust compliance as well.
That's awesome. And here's one for Rishab. Can automated follow-ups be customized for different populations?
Yes. Blooming Health, in Blooming Health, all of the communications can be customized in like 80 different languages, and all you need to do is provide an input in English. So our system adapts to diverse populations and translations, and depending on their needs.
Amazing. That is incredible. Okay. And with that, we are going to wrap up our session for the day. I want to thank everyone again for coming and attending today, and we hope that you found the information valuable. We will be posting this recording to our YouTube channel, so make sure you're following Blooming Health on LinkedIn to keep up with all of our upcoming webinars, and follow us on YouTube to continue seeing our product webinars, and we also post all kinds of great industry resources there. Thank you again, Rishab and Naman, and everyone have a great day.
Thank you, everybody.
Thanks all.